that through this push, now they have agreed to empanel the facilities.
But even before that,
yes.
I'm assuming that this proposal was being made, and of course with the push that then the same entities that you're talking about could be encompassed to these two main, and then they are carried under one or two umbrella. What is so difficult about that?
No, that is not what it meant. It was interpretation of those, actually not interpretation. It was just people trying to suit their selfish interests.
Okay.
Because the issue of merger of regulatory bodies,
yes,
and the issue of empanelment, they are exclusive.
Two different things.
They are exclusive.
Okay.
In empanelment, they are actually not required to know
whether you're under
whatever regulatory bodies, because they are supposed to just receive the list from everyone, the nurses, the physiotherapists, the lab, and whoever else. And upon receiving, they are supposed to empanel. They do not even have an option of doing anything else.
But you had been locked out, evidently.
Yes, we had. And that is why I'm saying that
finally you've reached
these people went outside the law. And that is why we call them a cartel, by the way. I don't call them a cartel because I hate them.
I was about to ask you that. Why would you look at this body that is enshrined in the laws and call it a cartel?
SHA is not the cartel. It is the people working within SHA.
So it is SHA, not KMPDC.
In collusion with people working under the Ministry of Health and people working under the KMPDC. And let me tell you why they are cartels. What is a cartel? A cartel is an amorphous formation, an amorphous group that works in the darkness.
Whether registered or not, because Cap 253 of the laws of Kenya, you understand very well that, of course, a KMPDC is under this act. So you cannot
That is what I'm explaining.
Okay, proceed.
They go outside the law to pursue their interest. And this is how they were doing this. They were trying to push everybody to KMPDC. That is going to benefit KMPDC monetarily, but then illegally, because they are not supposed to be registered there, whether it's the facility or the person. Then you look at the Social Health Authority. What is their interest in engaging into the regulation side, which is not theirs, because for them, they're only supposed to empanel the contract.
All right.
And then you look at the ministry. The ministry has been actually, some of the players within there, they have been the drivers of all this, of pushing the Social Health Authority without a written policy to be able to do this, which is against the law, and they know. And that is why we have been saying that that is cartelism. If you look at the definition of cartelism, that is cartelism, and that is what killed the NHIF. If it's not checked, it is the same thing that is going to kill the Social Health Authority. I know they don't like me because of saying these facts, and we'll continue saying them. But the chokehold that has been maintained on SHA, especially by the KMPDC and some of the players within the ministry, if that is not going to be checked, we are also going to kill SHA. And you can keep this for records. If this continues the way it is, and doing these illegalities that are denying Kenyans access to health care, SHA is going to go down because Kenyans are not going to register. If you look at the numbers that have been registered, it is basically those who are employed, both in the public and the private.
We're talking about 9, is it in 9 million or what exactly?
The ones who are contributing.
The ones who are registered.
3.3 million.
Well, I'll check the records correct and tell you the ones that have registered and the ones who are contributing, because registration then would automatically mean you're contributing.
No, it doesn't mean.
It doesn't mean so. So you could have been registered, but you do not contribute.
Yes.
All right, well
I think they have registered to to around 19 million.
19 million, yes.
19 million. But